Hello everyone, and welcome to my presentation on contraception. My name is Janai Alexander. I'm an LPN to BSN program student at Indiana State University. This is my health education program number 4 for Community Health Nursing. The population at risk and those in need of contraception are individuals who are sexually active. Today's learning objectives include: number 1, the learner will be able to define what contraception is. Number 2, the learner will be able to describe irreversible methods of contraception. Number 3, the learner will describe the reversible methods of contraception, and those are intrauterine, hormonal, and barrier methods. Number 4, the learner will be able to explain fertility awareness as contraception. And number 5, the learner will be able to explain emergency contraception methods. Please pause this slide. If you haven't already done so, there is a pre-test that needs to be completed before you continue this presentation. Please copy or paste this link into your browser or smartphone, or you can click the link in the description below. Let's begin by defining contraception. Contraception, or birth control, is intended to prevent pregnancy. Some methods of contraception can prevent the spread of sexually transmitted diseases. There are 2 types of irreversible methods of contraception. With male sex organs, it is called a vasectomy. This is a surgical method that is often permanent. The surgery blocks the tubes that carry sperm to the testes, so this ensures the semen will have no sperm in it. It takes about 3 months to make sure that all of the semen has no sperm in it, so you will need to use other types of contraception. The surgery used for female sex organs is called a tubal ligation. As mentioned, it is a surgical method, often permanent. The surgery clamps, seals, ties, or cuts the fallopian tubes. The fallopian tubes are blocked to prevent sperm from reaching the eggs. Always know there are risks with surgery, and these methods are for those who never want children or more children. Now we will discuss reversible methods, like intrauterine devices, hormonal methods, and barrier methods. If you decide you would like to get pregnant one day, you can stop using these methods at any moment. With reversible methods, there are 2 types of intrauterine devices. The copper IUD works by preventing the sperm from reaching or fertilizing the egg, and the hormonal IUD thickens the mucus in the cervix to make it harder for the sperm to travel to the egg. With a copper IUD, this device can last up to 10 years, and for the hormonal IUD, depending on the brand, these devices can last anywhere from 3 to 6 years. Both are T-shaped devices, and they are inserted or can be taken out by a healthcare provider. There are many types of reversible hormonal methods. Starting with the implant, it is a rod that is inserted underneath the skin and lasts for 3 years. This is the most reliable method next to the IUD. Next is the injection, which is a hormone injection in the arm or the buttock muscle every 3 months. There are pill forms that are taken every day at the same time to be most effective. There are different types. There is a patch that can be worn on the upper body, lower abdomen, or buttocks and changed every week. There is a ring that can be inserted into the vagina and worn up to 3 weeks. These methods work by thickening the cervical mucus to prevent sperm from meeting the egg to fertilize. Now we will discuss the reversible barrier methods. The external and internal condoms are ones that are either worn on the external side of the penis or internally in the vaginal or anal canal. External condoms are most effective. These methods may protect against sexually transmitted diseases if worn properly and used properly. These methods prevent sperm from entering the body. Spermicides, in the form of a tablet, film, suppository, cream, or gel, are placed into the vagina an hour before intercourse. They need to be left in place for 6 to 8 hours after. They work by killing the sperm. There are diaphragms or cervical caps that are placed into the vagina to block sperm and are usually placed on the cervix along with spermicide. There are sponges that also have spermicide and they are placed in the vagina over the cervix. The next type of contraception is the fertility awareness method or the rhythm method. It works best with individuals that have regular menstrual cycles. If you have a regular menstrual cycle, you have about 9 or more fertile days each month. This method is best used by knowing which days you are most fertile and avoiding having intercourse or using additional contraceptive methods at this time. The last method of contraception we will be going over is emergency contraception. Remember, these methods are not to be used regularly. There are emergency contraceptive pills that can be available over the counter. When taken as soon as possible after unprotected intercourse, it is the most effective. They can be taken up to 5 days after unprotected intercourse. The second type of emergency contraception is the copper IUD and is effective up to 5 days after unprotected sex, but you have to get this placed by a healthcare provider. These types of contraception can be used if no other form of contraceptives have been used or if other methods have failed. Here are some additional resources on contraceptives by the Center for Disease Control and Prevention, Food and Drug Administration, Medline, and National Institutes of Health. Now it is time to check your understanding. Please pause this slide and take the time to complete the post-test. You can copy and paste this link inside your browser or mobile phone, or you can click the link below in the description. If there are no further questions, here are the references for my presentation. Thank you again. My name is Janai Alexander. I am an LPN to BSN program student at Indiana State University, and this is my health education program for Community Health Nursing.